Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I want to share one of the Egoscue method exercises called supine lying. How you can do this for an extended period where your body is in a more relaxed position with assistance with positioning. So, what is the Egoscue method? The Egoscue method is a method that is a series of postural exercises. So they are different positions that you hold for an extended period, and it allows the body to heal itself. And it's a method using exercise and positioning rather than surgery, drugs, or manual manipulation. So it is a great tool that you can do on your own to help yourself realign your body. And the idea too is when your body is aligned correctly, it will function and help you get out of chronic pain. So some of our pain is from the strain and stress on the body from being in these malpositions or these positions that will strain areas and provoke pain in the body. So supine lying is where you're going to lie on your back. Arms are 45 degrees away from your body, palms up towards the ceiling, and your feet are going to be neutrally positioned with a block between your ankles. And if you want to hold this position for longer, a way to do that where you can just assist that positioning is to use a wall so that you hold your feet in that neutral position. So what I'm going to do is place my feet up against the wall so that they are going to be flat and held there, and I'm not having to hold with my muscles to keep them there for extended period, and it's just going to assist it. So again, this is just a modification for assistance, holding it for a longer period, mainly so that you can get the back to start to flatten down to the floor. But it's not going to take the place of doing this where you're using your muscles to hold. So it's just helping you to extend the position to help you with the back. So supine lying is one of the exercises to assist with reducing chronic low back pain. So you'll take the block, place it between your ankles, and you're holding the block with your toes facing up towards the ceiling in that neutral position. Now, I have a piece of a TheraBand that I've tied in a really tight loop, so it's got a little bit of give. It's not going to be compressing hard, but just enough assistance that I'll place it around both of my feet and the block at the same time. So with that assistance, that's what it looks like. And it keeps me from my feet from going out to the side. So it's going to hold my feet up against the block nicely. And it just gives that little bit of assistance where I'm not having to work with my muscles to hold there for the extended period, and allows me to stay in the position. So then what I'm going to do is just lie onto my back, keeping my feet up against the wall, and then I'm just bringing my arms out to the side, 45 degrees away from my body. And I want to work on my diaphragmatic breathing, where I'm going to expand my ribs, not just up, but I'm really trying to bring them out and relaxing the back down into the floor. So this is the supine lying. It's one of the exercises in the menu for chronic low back pain. And if I do this modification, it just takes away that constant hold that you'll do in the legs and the ankles. And it can help you to extend that position if it feels good to you. So it's one of the positional holds in the low back pain menu that I do suggest if you're getting pain in that position. Do not do that. So sometimes if you've got stenosis or a disc problem in the back, this exercise can actually provoke pain. So if you do have pain in the position, you want to come out of that position. If it feels good to you and you're finding that you need longer to get the back to relax down to the floor, that's a modification to hold that position for longer without having to continuously hold it in the lower part of the legs, and it gets that back to flatten down into the floor. So that's just a modification for the supine lying to assist with the leg hold. And I hope this is of help. And Let me know if you have any questions in the comments below. Have a blessed day.